Hi, this is Dr. Cook, and I wanted to just get with you for a little bit to just talk about getting started with the iHuman virtual simulation cases. If you're new to Chamberlain and you've come from another school and you transferred in, you probably don't know much about iHuman, but it is a virtual simulation platform where there's a lot of different little EHR, history and physical. So there's a lot of different layers of clicking into it to come up with the conclusion to pass with a 76%. A lot of it is new NCLEX style testing where you can click on the labs, you can click on the meds, you can click on all of the stuff, but you have to understand how to use it to make it to where you're learning and getting the score that you need to pass it. So the next slides that you're going to see are a breakdown of how to go through the iHuman process. So many times in the sessions that we have, I hear from students, why do we have to do virtual simulation? I just want to go through the motions and get off. But here's the thing, virtual simulation is going to go with you for the rest of your career. If you're taking ACLS, it's now in virtual simulation. If you are going through BLS, sometimes it goes to virtual simulation. Our methods of training in the future are going to be a lot of online virtual simulation. You have to embrace it because it's going to be here. We're going to see it, and it's helpful. And in the place where there's a lot of we have trouble getting into clinical facilities, we have to be able to use virtual simulation to use some of those hours. And so one of the great things is whether you're in here in a 12-hour day or if you're in a 12-hour day, virtual simulation is a clinical day that requirement from the school. It's a requirement from the accreditation. It's a requirement from the nursing board of nursing. So you must embrace virtual simulation, but you will get out of virtual simulation what you put into it. And one of the things that I feel really helps is virtual simulation helps with preparing you. It helps with confidence. It helps you in a safe environment make decisions on your patients. So embrace the world of virtual simulation because you're going to see it. It's going to be with us. And we have found that it has really helped students learn clinical judgment. Let's talk about the Robert Jones case. So when you get into iHuman, you're going to have the iHuman case instructions. It's also going to tell you what objectives you are supposed to learn by doing the iHuman case, and they are listed under student learning outcomes. So it's real important that you understand what you're doing when you go into the iHuman case. These outcomes will tell you what the expectations are for you to learn by doing this iHuman case. This Robert Jones case is also an exercise, and it is a sample case that you can go in and do before you have simulation. You cannot go ahead and do the cases that are coming up in your classes, but until you are in the actual setting. But you can go into the Robert Jones case, and I suggest that so you can get more comfortable for what is going on inside the iHuman case. One of the things I love about the iHuman case is your pre-work, because the pre-work is really getting you to think about all the things that are involved in the iHuman case of the case that you are working on. And so the pre-work questions are designed to help you do the case better, to understand more where you're going, what they're looking for, how they're identifying things. On Mr. Jones here, there's some information that's very key information about his case. It tells you why he's admitted to the hospital. Was it an emergency admit? Where did he come from? His age, his medical diagnosis. And in this case here, he has a chronic osteoarthritis. So he's coming today to have a total knee arthroplasty. You have to know what that stuff means, because if you don't know what it means, you're not going to be able to answer the questions that the iHuman is asking you when you have to do action and prioritize and what do you need to do for the patient. So this is stuff that's really, really important. So if you don't know what this means, you need to look up these words and understand them, because on the this is just a surgical reconstruction of the joint. And when they get in there, they may do more, they may do less on that knee. So we know if he's got chronic osteoarthritis, we know that he's probably got some pain issues, and he's probably got some walking issues, and he could be a falls risk. So those are all the things that you really need to think about, because this is even though you're not at the bedside with a patient, it may be a little bit easier for you to analyze that, but it's really important that on the virtual sim side that you can really think beyond and outside the box. So this stuff helps you think this way. And I think once you get the pre-op and once you understand everything that needs to be done with the pre-op and a post-op patient, because we have a lot of things going on, it will make the human case more understanding, and you will get more out of you will get more out of what you are doing. This is not going through the motions. This stuff is designed for you to learn. Let's talk about some of the objectives for the iHuman cases. There's an EHR, a history and physical. You're going to characterize findings. You're going to identify client problems. You're going to prioritize problems. You're going to select actions. And you're going to do a nurse's note at the end, and then there's a summary that talks about patient outcomes. I want to talk a little bit about the headings that are in the iHuman cases, because in Robert Jones and all of the other cases, you're going to see a heading at the top, and we'll go through that in a little while. But the very first one you'll click on is the EHR. Remember, the EHR is a digital health record of patient information. It's so good because in the new NCLEX questions, you're going to have a lot of this information. So you will understand it in the future when you go in to take your NCLEX. But all of this information is very pertinent and is what we use in the hospital setting. So the electronic health record was all the digital health information for that patient. There's a history. It's usually under history and physical, but in the iHuman case, it'll be under history and then it'll be under physical. So there'll be two separate categories. You're going to record all the health information about that patient, their allergies, immunizations, surgeries they've had, general health, childhood illnesses, medications, anything that's pertinent to the history of that patient. That's all the data that you collect when that patient first comes into the hospital setting. And then, of course, the next heading will be physical. So that is all the head to toe and focused assessment that you're doing on the patient. That's where your vital signs are. That's where you're assessing lung sounds, heart sounds, bowel sounds. You are checking the skin. You are going from head to toe. You're checking every bit. And those boxes are in the iHuman case so that you can click on them and you can actually take the vital sign machine and actually do a vital sign in the iHuman case itself. And then all of that data that you just get on those three top categories, you're going to analyze it. What does the data tell us? Is there any trending vital signs? Is there any trending pain? Is there any trending labs? Do we see things? Maybe he's running a fever. Maybe his potassium level is high. So those are how we take all the data that we've just collected and we analyze it to see what is the actual problem. And then, of course, whenever there's a problem in nursing, there's always an action. What are you going to do? What are you going to implement to the plan of care for that client? That's very, very important, because nursing is very much autonomy, and you have to be able to understand each part of this. And iHuman does a really great job on using each one of these in an increment level. Then there's going to be after you implement the plan of care and you've got a plan of what you're going to do for this patient, and our Robert Jones patient is probably going to have a lot of post-op pain, and he's going to have a lot of things that we're going to have to deal with on a level of a post-op patient coming out of surgery. And then you like every time you're in the hospital, you are always given report to the next nurse. You're given report to the oncoming person. If you're going off, that is a nurse's note. So you are given an SBAR. You are actually going to give, in the iHuman case, there's a little section that's going to tell you some stuff, and you are going to write an SBAR over that. And then in the summary at the very end, there's always a summary that tells about patient outcome and expectations for that patient. So iHuman does a very nice job putting it at the top. It's very easy to click through. But again, if you don't know how to do this, you really need to go back through the Robert Jones case so you get comfortable with this type of process. So what I did was I broke down these sections, and then I've got some actual iHuman where it's going to go in and kind of show you where you go in the case, which it makes it much easier for you while you're kind of navigating yourself through, because there's a lot of boxes, there's a lot of clicking, there's a lot of things that that iHuman expects in the virtual sim, and so I think breaking it down into these sections will really, really help. So these next slides are going to be actually a breakdown of how they do the EHR in iHuman, and I put these in segments so that they would be easier for you to understand how you go through it, because you really need to know how it's used in the iHuman case. There's a lot of critical clinical judgment information, and I know you've studied that in class, and it's really important that when you're looking at labs, when you're looking at vital signs, when you're looking at all that stuff, on the patient side in the hospital, and the same on vSIMs, it's really important that you know what is going on. I always tell my students, if you're going to the bedside, make sure you look at everything with your eye. You can find out so much by just looking. You can tell if a patient's happy or if they're sad just by how their demeanor is. And then you look and you gather all that information, and the more you know in nursing, the more powerful it is. And the better off you are as a nurse. You are a much more better nurse when you know all of the information about your patient, because then you can see things change. You can see trending data. So here's the EHR in the iHuman case. So listen to this presentation.
Hello and welcome to iHuman Patients by Kaplan. As you embark on this exciting journey, please note the tabs across the top of the screen. We will talk about the Electronic Health Record, or EHR. The instructions for this section are written out. Read through the EHR. Record your findings on the right. Click Proceed at the bottom when you are done. You can hide the instructions if you wish. Your goal in reviewing the EHR is to form an impression of the patient's acuity and develop a list of questions, assessments, or actions that you need to perform upon entry into the patient's room. EHRs and the ability to exchange health information electronically can help you provide higher quality and safer care for patients. On the left, let's review the tabs of the EHR. Review the timeline. Questions to consider. How long has your patient been hospitalized? What significant events have occurred during your patient's stay? Review the healthcare provider's orders or plans. Consider, what is the condition and code status of your patient? Does your patient have any activity or diet restrictions? Does your patient have allergies or prescribed interventions? How often and what should you monitor your patient for? What are the actions you must take during your shift? Do these orders seem in conflict with the patient's condition or prognosis, or do you need clarification? Review the admitting healthcare provider note. In some cases, this will be very detailed, and in other cases, fairly limited. What are the admitting or current diagnoses? What are the current complaints or concerns? What is the list of concerns you may want to learn more about when you see your patient? In the progress notes, you would find subsequent healthcare provider notes, if available. This particular patient is a new admit, and there are no additional notes to review. Review the nursing notes. Consider, did your review of the nursing notes help you develop a more in-depth understanding of your patient's current situation? Did your review of the handoff SBARs help you identify the most critical concerns? After reviewing any recommendations, what will be the focus of your patient assessments and actions? Have you identified issues you will need to verify or clarify when assessing your patient? Hello and welcome to iHuman Patients by Kaplan. As you embark on this exciting journey, please note the tabs across the top of the screen. We will talk about the Electronic Health Record, or EHR. The instructions for this section are written out. Read through the EHR. Record your findings on the right. Click Proceed at the bottom when you are done. You can hide the instructions if you wish. Your goal in reviewing the EHR is to form an impression of the patient's acuity and develop a list of questions, assessments, or actions that you need to perform upon entry into the patient's room. EHRs and the ability to exchange health information electronically can help you provide higher quality and safer care for patients. On the left, let's review the tabs of the EHR. Review the timeline. Questions to consider. How long has your patient been hospitalized? What significant events have occurred during your patient's stay? Review the healthcare provider's orders or plans. Consider, what is the condition and code status of your patient? Does your patient have any activity or diet restriction?
Good explanation on the EHR, and it's very, very helpful because it showed you how to go in, to click up at that upper banner, and then go down that side. A lot like the electronic health records at the hospital, if you use Epic or if you use Cerner or whatever type of electronic health records they have. But it's really, really nice because it's always usually set right on that one side. I think probably in all of nursing, I think if you are an excellent if you can do a really good physical assessment and you've really got the history that you need, I think it tells you a lot about your patient. Sometimes not only is it a physical assessment, but it can be a mental assessment. Are they happy? Are they sad? Do they have family? Do they not? So don't just hone in on certain things and stay there. Just understand there's more elements to an assessment, but I think the history tells us a lot. You know, what is about their past? What did they say in an interview that might clue you in? You know, are they in a safe environment? Do they have family? Are they alone? There are so many things in that client interview that you can take and process of things that are coming up and maybe in the iHuman case and in a real life patient scenario. The physical exam, I like to tell my students, is probably the most important part, because if there's any data that's trending or if there's any problem, if you physically assessed your patient in the beginning, including vital signs, including maybe bowel sounds or lung sounds or heart sounds, if you truly assess that, if something changes in 1 and 2 hours, or maybe 4 hours or 8 hours, your assessment will come back and be your friend. So I'm a neuro nurse, a neuro ICU nurse, and what happens in the neuro department is neuro patients change very fast. It can be in a matter of seconds, especially if there's a brain bleed. So if you don't do a really good neuro assessment every hour, changes can be subtle. Well, the same goes with history and physical information. A physical patient could have very subtle changes. So it's really important that you hone in on a very important history and physical on the patient. Don't ever not do the assessment, because the assessment will help you in the long run. And it really gives us really safe patient care, because you are doing all that you need for those patients to be healthy. So this part of the iHuman case is going to tell you about the history on the patient.
When a patient is admitted to a healthcare agency, or when it is necessary to gather detailed information about a patient, you will collect an assessment using interview and observational skills. A patient-centered interview is When a patient is admitted to a healthcare agency, or when it is necessary to gather detailed information about a patient, you will collect an assessment using interview and observational skills. A patient-centered interview is relationship-based and is an organized conversation focused on learning about the well and the sick as they seek care. During an initial history taking, a primary objective is to discover details about a patient's concerns, explore expectations for the encounter you are having, and display genuine interest in partnership. A patient-centered interview becomes the basis for forming trust and effective long-term therapeutic relationships with patients. Using a structured approach for your patient interview will ensure you are both thorough and effective. At first, the structure may feel difficult, and you will go slow and may make mistakes. Do not worry. It takes time to learn and become comfortable talking with your patient. With practice, the structure will become natural and boost your self-confidence as a nurse. There are 3 ways to interact with your patient. Select questions from the category folder system. Click on a category to expand, then click on the subcategory and select your desired question. You can also type a question into the search bar. This populates a list below the search bar of suggested questions based on your search text. Select your desired question from the list. This feature works best if you type in full sentences. Or use the microphone and speak the question out loud. Start with the patient encounter to set the scene. Introduce yourself. Hello, I am your nurse and will be taking care of you today. Validate correct patient. Can I take a look at your wristband to confirm your identity? What is your name? What is your date of birth? Next, define the purpose and importance of the nurse's visit to the room. I am here to perform an assessment. Take this time to establish rapport and overall patient status. Do you have any pain anywhere? Do you have any other symptoms or concerns we should discuss? This interview provides subjective information. Use this time to first confirm and explore the status of known patient concerns or problems identified in the EHR. Second, ask about new patient concerns or problems. Third, clarify information in the EHR that appears conflicting. Fourth, complete or verify portions of the patient's history that may be missing. And fifth, review major body systems for new concerns or problems. At the conclusion of the interview, use this time to wrap things up before leaving the room. Check the following. Are you comfortable? Do you need to use the bathroom? Do you have everything you need? Do you know how to use your call button and bed controls? There are several additional features to help develop your history-taking skills. If there is a limit to the number of interactions you may make in your history, that number will be provided to you at the top of the page. This item updates with each interaction. There may be an indicator informing you that an interaction was previously made, if your cases were designed to include this. If your cases were designed to include the Show Dialog button at the bottom, then you can use this to view a transcript of your interactions with the patient in the order they occurred, as well as the patient's responses. Remember to document your findings to the right as you work through this section. When finished, click on the Proceed button to continue to the multiple choice question and feedback. A pop-up will appear asking if you are ready to finalize your section. Once you have clicked Yes, your grading for this section will be finalized. Note, after each section, there may be multiple choice questions, exercises, or feedback. Additionally, you will not be able to access the section you most recently finalized. However, you can
If
return
you
to
noticed on the history, there were a lot of questions. Always remember, it's just like you were at the bedside. Don't try to cheat some of the questions, because iHuman wants to know that when you leave that room, what are you going to do for that patient? It's all about patient safety. So, and the more questions you ask, the better off you are, because as a nurse, the more you ask, the more you know. If you don't ask, you didn't know. So just remember that, and remember you are always going to take that right side column and you're going to document your findings. Anything that is abnormal would be findings that you would want to put in that documentation. Most of the time you're going to hear in the hospital setting history and physical. In fact, if you go into a doctor's note, if they came into the ED or if they were an admit, within 24 hours, there's usually going to be an H&P. It's called an H&P. It's on the chart. It tells you all the information. Let's just say that you showed up in the ED, you had a temperature, this is what was going on, or you fell at home. That information is all in the history and physical. I always tell students that are in a clinical setting to always find that and read that information, because even though the patient maybe have been in the hospital for 5 or 6 days, it kind of sets the tone and it tells you all about the patient, and it's very much it's called H&P in the hospital setting. So this next one that you're going to do is on the physical exam. This is where the vital signs, where you're going to maybe assess their respirations. You're going to hear the patient breathing in the Robert Jones case and in all the cases. And you're going to maybe listen to lung sounds. You can actually listen to the front side of these patients. You can turn them over and listen to the back side of these patients. It might be a height and weight. It might be bowel sounds. It might have diminished lung sounds. So there's a lot of different stuff going on with the physical assessment. So here's the Robert Jones case on physical exam.
Using a structured approach for your patient's physical assessment will ensure you are both thorough and effective. At first, the structure may feel difficult, and you will go slowly and may make mistakes. Do not worry. It takes time to learn and become comfortable assessing your patient. With lots of practice, the structure. Using a structured approach for your patient's physical assessment will ensure you are both thorough and effective. At first, the structure may feel difficult, and you will go slowly and may make mistakes. Do not worry. It takes time to learn and become comfortable assessing your patient. With lots of practice, the structure will become natural and boost your self-confidence as a nurse. Objective assessment. During this assessment, you should confirm and explore the status of known patient concerns or problems identified in the EHR and history. Remember, you have the list to the right. Clarify information in the EHR and history that appears conflicting. Complete portions of the assessment that might be missing in the EHR and look for new patient concerns or issues. In history, we noted pain in the calf. In the exam with visual inspection of the calf, we noticed new symptoms, 1+ edema and redness. Also noted in the EHR that we needed to complete a comprehensive assessment since our patient is newly admitted to the unit. There are 2 types of physical assessments that iHuman uses. A comprehensive health assessment gives nurses insight into a patient's physical status through observation, the measurement of vital signs, and self-reported symptoms. It includes a medical history, a general survey, and a complete physical examination. A comprehensive assessment is performed when the patient is first admitted to the hospital. A focused assessment is a detailed nursing assessment of a specific body system or systems related to the presenting problem or other current concerns. Depending on the patient, more than one body system may be assessed. During a focused assessment, the patient may report a specific symptom within a particular body system that requires additional investigation. A focused assessment is performed in the emergency department or clinic, focusing on the concern that brings the patient in seeking assistance. In most cases, you will start the patient encounter with a set of vital signs. Find the vitals heading and click on the item that you want to measure and follow the written instructions. For example, the pulse. Notice the landmarks over the left wrist. Click on the pulse landmark and count the number of beats per minute. Use the timer at the top as you count and complete the documentation to the right. A similar process is used for respirations and blood pressure. Use the list as a guide and consider necessary exams. Not all will be used for each patient encounter. What you select will depend on a number of factors: type of assessment, patient history, and what you find in the EHR, etc. Be sure to think before you click on the exam, as there is a maximum number of exams that you can select for each.
One of the things on the physical assessment, when you're assessing your patient, just understand there's marks, there's little guides for you to follow. Make sure that you follow that. And make sure you understand, if you're doing a focus assessment, a comprehensive assessment, what needs to be assessed on your patient. Really, really important, because depending on areas, and they mentioned the ER, the ED, and we do a faster assessment because we're trying to take care of the actual problem that's going on. But in the Robert Jones case, he's actually came in an emergency, but he's going to go to pre-op and have scheduled surgery for that knee. So just make sure you understand what you're clicking through the iHuman cases. So one of the things with iHuman, you actually have done your history and physical, you've gotten all the data, you've got the information that you need, and now we're going to take those key client findings and we're going to characterize what those findings are. So let's just say in the Robert Jones case, let's just use him. He was probably very painful. Whether it's 8 out of 10, 10 out of 10, the people that are having those type of surgery and have that osteoarthritis really live with a lot of pain. So we may say that over the last 2 weeks, his pain level has been so out of control that the medication that he's on is not fixing it. His vital signs are starting to go up, because sometimes when you're in pain, your heart rate goes up. So we might see trending vitals. So if that's an issue, that needs to be addressed. Let's just say he had an infection and the temperature was going up over the last couple days. Those are characterized findings that we find going on with that patient that we need to address. So the next section that you're going to do will be characterized findings in the iHuman case. So here's the iHuman case on characterized findings.
We identified findings in the EHR and then verified these findings and identified additional findings during our history and physical assessments. Now that we have identified the patient's findings, it is time to develop. We identified findings in the EHR and then verified these findings and identified additional findings during our history and physical assessments. Now that we have identified the patient's findings, it is time to develop our care plan. We need to continue to use our clinical judgment to characterize the time course of the findings. This is one step in prioritizing care when developing the care plan. We see a list of expert findings, separated by those of the EHR, history, and exam. Questions to ask ourselves are: does the patient have a history of this finding? For example, in the EHR, we identify the patient has a shellfish allergy. This allergy is not new for the patient, so then the finding would be no change. Click directly on the words "No change" to add it to your finding. When we did our patient interview, we verified the allergy and the patient's reaction, a rash. The patient confirmed the allergy and reaction, so again the findings would be no change. A second question to ask: is this a new finding for the patient? We discovered in the EHR the patient had right knee pain 4 out of 10, which is a new finding. We identify this finding as acute. Another example of a new finding is the calf pain that we discovered during the interview. We label that as acute. A third example is a redness and warmth to the right calf that was found during the physical exam. This is the first time we learn of this characteristic, and, as such, label it as acute. A third, but related, question to ask: Has this finding changed in any way? If so, how has it changed? For example, the right knee pain of 4 out of 10 found in the EHR was labeled as acute. We verified the right knee pain during our interview and learned the patient now rates his right knee pain as 5 out of 10.
And remember, any change, if it's like pain starts 4 out of 10, and an hour from then it's 5 out of 10, and then maybe later it's just going up, or let's just say you've medicated the patient and they're a 4 out of 10, and then they're still not relieved. Those are trending characteristic findings that we have to look at. Also, calf pain, very, very important to notice. For DVTs, redness, those are all characterized findings that need to be addressed, right away in the patient. Now, on the next section of the iHuman case on Robert Jones, we're going to identify the client problems. Depending on where you are and what type of setting and in what hospital setting, a lot of med-surg settings, a lot of ICUs, there may be many problems. And sometimes a patient comes in with one problem and there's 5 other problems addressed. So let's go into the Robert Jones case and see about identifying client problems.
We continue with our clinical judgment by placing the findings into categories. These categories are concepts that move away from subject-specific content and instead emphasize big ideas that span multiple subject areas or disciplines. This allows the nurse to focus on broad concepts, such as oxygenation, perfusion. We continue with our clinical judgment by placing the findings into categories. These categories are concepts that move away from subject-specific content and instead emphasize big ideas that span multiple subject areas or disciplines. This allows the nurse to focus on broad concepts, such as oxygenation, perfusion, or comfort, when developing the plan of care. For example, we find multiple findings related to the patient's pain. By reviewing the patient problem list, we would place these key findings in the comfort category. To select comfort as the client problem, click directly on the word comfort to add it to the highlighted finding. Another example is the findings that relate to the patient's shellfish allergy. Again, we would place these key findings in the immunity category by reviewing the patient problem list. The allergic reaction would go with immunity as well.
This is a really good part of iHuman where you are actually going to put them in categories, because that's something as a new nurse that you have to learn to develop. They talked about clinical judgment, and clinical judgment is so important. And it's sometimes hard to teach, but these type of processes in the iHuman and the vSim they really hone in on allowing you to use some kind of clinical judgment to kind of anticipate or to put it in a box to kind of see, is something changing, is something going on. So it's really good that you take time and you really understand that as you're clicking through the iHuman cases. So through Robert Jones' iHuman case, we did the EHR, we had findings, characterized findings. We took all the data, you did the assessment, you did the history and physical, and now we're going to take everything that we saw and we're going to prioritize this client problems using ABCs. I'm sure that's been drilled in you from day one, always ABCs first. And you've got Maslow's, and so you have a way to prioritize these client problems. And iHuman really does a really good job allowing you to prioritize the problems with this client. So let's take a look at prioritizing the client's problems.
Now that we have placed all the findings in their appropriate categories, we need to use our clinical judgment and prioritize the patient categories. As we see, there are 5 categories that we have identified: immunity, activity, rest or mobility, comfort, behaviors, and perfusion. In this particular case, we need to Now that we have placed all the findings in their appropriate categories, we need to use our clinical judgment and prioritize the patient categories. As we see, there are 5 categories that we have identified: immunity, activity, rest or mobility, comfort, behaviors, and perfusion. In this particular case, we need to select the number 1 prioritization category. As a side note, in other cases, there may be more or fewer categories to choose from, and the number of categories to prioritize may be different as well. When prioritizing items, consider items such as unstable versus stable conditions, acute versus chronic, unexpected versus expected, physical versus psychosocial, and ABC items. In this case, we would select perfusion as our number 1 priority.
One of the things with virtual simulation that the iHuman has allowed is the new NCLEX questions that are out are, of course, a lot of unfolding case studies that have a lot of the topics that you're going to go through that you'll be able to click through. And one of the things that I really, really like here is you're going to drag and drop that information into the other side of the iHuman box, and that is going to get you to practice the drag and drop type questions, which you're probably already doing now in your classroom, but they went ahead and added the feature in too. So it really, really helps that you learn how to do that, because let's face it, we all need to pass the NCLEX. That's the goal of the nursing program, is that we pass the NCLEX in the end. So the drag and drop is a nice little additive there in the iHuman case. Now next we're going to go into Robert Jones, and he's going to show you how to select actions. This is the plan of care. What are we going to do for this patient? We already identified that there was a perfusion problem, but what are we going to do for a plan of care for this patient? So let's look at selecting actions.
Now that we have identified our patient problem of perfusion, we need to use our clinical judgment to determine what actions we want to take. Now that we have identified our patient problem of perfusion, we need to use our clinical judgment to determine what actions we want to take. First, take a step back and consider this. Are we treating the chart or are we treating the patient? Are there key findings from the EHR that we need to address, or as we verified these findings during our assessment, are those the key findings we need to act on? For example, if we identified in the EHR our patient was febrile, would we act on that key finding, treating the chart, or would we act on the key findings of verifying in our assessment the patient was still febrile? In this case, we would review all the actions in the perfusion section and determine which actions would be appropriate at this time. To access the list of actions, simply click on one of the findings. Click on Perfusion to reveal the actions pertinent to that patient's problem area, and read through them. In relation to calf cramping, we want to apply a warm, moist compress. Note that you are limited in the number of actions you can select. This is put in place so you consider the appropriateness of the action before selecting. Another point to remember is not every finding will have an action, and there may be times when the finding has multiple actions. For example, for the 1+ pitting edema, you would want to elevate the extremity as well as notify the healthcare provider of unexpected peripheral edema. Consider not just that which is ordered in the EHR. We expect that you will take that action. You want to consider independent nursing actions, like applying a warm moist compress.
There's that clinical judgment piece again. Very, very important. And it comes with time. You'll get better at making decisions and plan of care. But I liked he talked about independent nursing actions. What are you going to do for plan of care of that patient? So that was a really good part. So really think about that when you're in selecting the actions for the patient in the iHuman case. Every iHuman case ends with a nurse's note, an SBAR. Your whole nursing career will be an SBAR. The Robert Jones case and every case in iHuman is going to give you a little scenario at the end, and then you're going to go in and write a nurse's note. It's probably a weak area because we do so much by the computers now that we just click within normal limits and we go right down the list. But documentation is very, very important for your license. It's very important to hand off to another nurse. And so this little section in iHuman will be an SBAR report that you're going to give on the patient.
Finally, we want to write our nurse's note. A nursing note is legal documentation into a medical or health record made by a nurse that can provide an accurate reflection of our assessments, changes in patient conditions, care provided, and relevant information to support the clinical team's delivery of excellent care. In short, the patient's nursing record provides a correct account of the treatment and care given and allows for good communication between you and your colleagues on the healthcare team. Finally, we want to write our nurse's note. A nursing note is legal documentation into a medical or health record made by a nurse that can provide an accurate reflection of our assessments, changes in patient conditions, care provided, and relevant information to support the clinical team's delivery of excellent care. In short, the patient's nursing record provides a correct account of the treatment and care given and allows for good communication between you.
One of the things that I'd like to say about documentation, as a new nurse, you're going to be some days overwhelmed. You're going to have a lot of information. You're going to go home at night. You're going to be laying in bed and go, I don't think I documented that I did a dressing change. But as you get into this profession and you have some time under your belt, just remember that documentation is so important, because if it's not documented in a court of law, it was not done. So don't ever skimp on those areas. Always, always, always document your findings. Always document you called the healthcare provider. Always document that you went in and assessed and reassessed and you analyzed things and your patient was comfortable and you left the room and they had the call light in place and the bed was in low position. It's all about patient safety, and a lot of your NCLEX questions are on patient safety, and as well as the iHuman case, it's about patient safety. So be really, really diligent in your documentation. So I want to give you some tips on iHuman, because sometimes iHuman can be kind of overwhelming with all its click boxes and all the different things. Always, always, always read the instructions first. Understand the instructions before you even start. You know when you go into the iHuman, it's going to give you a scenario of the case. You've already done the pre-work. It's really important that you tie all of that together with it. Review the case. It's giving you a scenario of the case. Take your time. Don't rush. You're going to have enough time to get the VSIMs done. Always, always, always look for the abnormal findings and things that are important. Some of the stuff is distractors. It's not an abnormal finding. But when you know the problem for your patient, you're going to know what the abnormal findings are, because you're going to see it and you're going to read about it. In the history section of iHuman, always ask all the information. That is your time to click through all the history information, because listen, most all the time, all those questions need to be asked. And when you leave the room, make sure you're clicking on exactly what you did. It is just like you are in a physical room with the patient. When you go into the room, also nursing introduction. Hi, my name is Nurse so-and-so. I'm here today for this. Wash hands. All of the stuff that you would do at the bedside. Even though it seems like, oh, well, they know I know that already. You're going to assess for allergies. You're never going to go in and not assess for allergies. Those are things that are automatic. You should get used to it. The iHuman has enough of that in there where you can click through it. Here's some more helpful hints on iHuman. Analyze acute, no change in worsening. So you're going to analyze, is it an acute change? Is it a no change problem, or is it getting worse? If they have a pain of 8 and it's now 10, it's getting worse. If they had a pain scale of 4 and it's a 3, there's no change in it. Choose ABCs. Always choose airway. In this particular Robert Jones case, it was about perfusion, because we had a possible DVT. We had calf pain, so we had a circulation issue. Actions, communicating with the patient. Always communicate with the patient. And a lot of the cases will kind of give you a little bit of feedback. It gives you a little expert feedback. Sometimes they do it on some cases, sometimes they don't. The SBAR is very, very important that you're going to do at the end. And picture yourself at the bedside taking care of the patient. So if you get stumped on some of the stuff that they're asking, think, I'm at the bedside. Would I do that or would I not? Think about patient safety, client safety. That is really, really important. Every question for the NCLEX is related around patient safety. Remember, you must get a score of 76% or better. You have 3 tries. You can get in the 80s and 90s if you take your time and you do this correctly. Don't rush through it. This is a learning environment for you to learn. If you just want to click through it and get done, you may miss something in the clinical setting in the future. So it's really important that you take your time and you do the virtual sim the correct way and learn something. I always say, in nursing school, because I went to nursing school, and I know there's a lot of information. But, some days, if you can just learn 3 or 4 things out of what is being taught for an hour, you've learned something. So you've got to take little increments and try to add to your knowledge base. Learn it simple first. I always say learn it simple first and then add the hard part on. I said this earlier, iHuman Practice Case helps you navigate and learn the virtual simulations. If you have to go in for the first time, you've never seen iHuman before, it can be overwhelming. There's a lot of boxes, there's a lot of information, and so take your time and go through it. When you go through I'm going to talk a little bit about pre-brief and debrief, because when you come into the virtual simulation environment, you go to a pre-brief. So pre-brief questions were already given to you. And then when you go into with your instructor led, there's a pre-brief. So basically they're giving you some information about the patient. Then iHuman shows you a video. It could be 7, 8, 9, maybe 10 minutes. And it's got some information that they're talking about the patient. And then you go off and you do your 2-hour simulation, and then you come back and debrief. Debrief is just to say, how did you feel you did? What can you learn better? Was action and prioritizing hard for you? Because if you once you go and you download your PDF, you can actually go in there and see where you excelled and where you didn't excel. So that might be something that you might want to really look at in the future when you're studying for NCLEX or you're studying for an exam, because maybe action interventions, any of that kind of stuff may be a lower area for you. So take advantage of what the iHuman tells you. Remember, you're going to take the PDF of the performance overview, and that's what gets uploaded into Canvas. So it's really important that you follow instructions on that case. But just remember, the more you learn, the better you are, and the more confident you get. I know this was a lot of information, and I tried to keep it kind of short where I could just give you some information that might just help you in the virtual world. Remember that virtual world is not going away. Virtual world is going to be at the bedside, because we take people in and we do virtual simulations, and you have a lot of CEUs. So you think once you're done with nursing school that the learning has stopped, but it's only just begun. I hope the iHuman case helps. Please don't be afraid to reach out, ask questions. If you don't know something, if you don't understand, and go into the practice case, please do not go into iHuman cases and do them before your class, because you will be penalized for that. You cannot do that. You must wait till the day of virtual simulation. If there's any other questions that I can answer for you, please reach out. Thank you for taking the time and listening. I really hope this helped, and y'all have a good day.